Okay. All right, I have 101, so if you want to get started.
Sounds good. Thank you. Thank you all for joining us today. Once again, I think we all know each other fairly well by now, but I'm Dr. Matt Burchett, the chair of the TAC, and we'll get things going. I think we've, from earlier there, I think we said we've established that we do have a quorum of TAC members, so we'll go ahead and get the meeting underway here. First order of business for us today, of course, is, as always, the approval from the previous two meetings that we've had, of the minutes of those meetings. So we'll start with the regular meeting from last year, the last regular meeting, and then we'll go to the special meeting. So if I can have a motion to approve the minutes for the last regular meeting of the TAC.
Could I just ask that if you are a member, could you please engage your camera so that we can have a record of your vote?
Mr. Chairman, Steve Compton, I move to approve.
Gary Upchurch, second.
Thank you, guys. Any discussion? Hearing none, we'll all those in favor of approval of the last regular meetings minutes, say aye.
Aye.
Aye. Good. And those opposed? Now, since that's done, let's do the special meeting we called there in December. I'll take a motion to approve the minutes of that meeting.
Steve Compton, Mr. Chairman, I move to approve.
Gary Upchurch, I second.
Thank you, gentlemen. Any discussion on those minutes? Hearing none, then I'll take all in favor, say, of approving those minutes of the special meeting, say aye.
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 Aye. And any opposed? Okay, so approval of both sets of minutes, that's good. That's got that out of the way. Little house cleaning. Moving on to the number 4 item there on our list is the old business. And we'll just start at the top and work our way through. If you'll excuse me, my voice is a little crackly today. So at the November meeting, we talked about the optometrist reporting our no-show rates and asked if DMS would have any way to collect those numbers of no-shows that we've reported and share those with the TAC. I know talking with some of the TAC members about this, I think Steve and Gary said they had several no-shows that they'd reported, but does DMS have any total numbers across optometry to be able to report to us?
Yes, this is Kelly Kitchen, and I also apologize. My voice is still messed up. So we do have numbers, and this was actually ran for you when you requested. It just did not get to you, and I apologize for that. We do have, we are showing that the overall total of canceled appointments, and this again is up through November of 22. January 1st of 22 through November of 22, and those total canceled appointments was 496 total. And then we have a total of missed appointments during that same time period of 1,947 missed appointments.
Mr. Chairman, may I speak? Steve Compton.
Yes, go ahead, Steve.
I got that spreadsheet this morning and it shows Compton and Compton Eye Care with between the missed and the canceled of 285 in calendar year 22.
Yeah.
We actually reported 575. I looked it up this morning. So these numbers are not, they certainly don't reflect our practice.
Were those
Okay.
reported within the Kentucky Health Net?
Yes,
Okay, is that only through November, from January 1st through November?
no, that's January 1st through December 28th, I think.
Okay, so the report was ran up through November, and we actually ran that when originally requested. So we do only have up through November.
Okay, but I don't think I had 300 no-shows in December. 290, I'm sorry.
This is Justin Derringer. We'll definitely take a look at that and see if there's a discrepancy and if it is, why. I did want to let you all be aware that we are currently working on another initiative that has for no shows in particular. That's project's already been started. It's underway. We were hoping that it would be completed by January 1st. However, it's not complete. Like most IT projects, it's taking a little time to develop. But basically, that project is going to be a tool for you all to be able to go online and to be able to pull up any specific provider type and look at the no-shows for the provider type based on year. You can break it down by month. You can pull up the reason why, if there was a reason listed for the no-show. And, that's a tool that we've just created or in the process of creating that hopefully is going to help not only you all, but will help us as we continue to try to solve this no-show issue. But we'll definitely check on that numbers issue and see if there's anything that's not correct about it.
Yeah, well, my point being, I think the problem's a lot worse than maybe DMS realizes. It's an issue, at least in our practice. Thank you.
Thank you, Steve. Any other discussion from any of the other TAC members on that before we move on? Okay, hearing none. The next item is the update, any updates from DMS on being able to electronically send our license renewals from the Board of Examiners to DMS.
Oh, fantastic. Got a lot of big weight.
This Justin Derringer again. Unless anybody else has
Justin,
yeah, go ahead.
it's Jennifer. I have a little bit of an update on that because my team had been working on that for some time.
Yes.
And we thought we had it worked out. And then when we got the file transfer this past month, we knew it wasn't correct. So we've taken a step back. We've recontacted them. We are still working on it, but whatever file that they sent to us, it was not correct. So it is still a work in progress.
Okay. Thank you for that. Any thoughts or updates on timeframes of trying to upload another file to them or anything like that?
I need to check with my staff on that. I apologize, I don't have a date, but I will say if anybody on the TAC can help support us in any way with the board, it might help a little bit to get a nudge from you all. They're responsive, but they're a little bit slow to respond to us. So, if there's anybody that has any influence in that way, we would greatly appreciate that help from you all.
And if we did, I would say if we did, who should they get in touch with you all?
The best contact will be Sapna Saraji. I'll put her information in the chat since that might be a little challenging to spell.
Oh, come on now. That's fine. Yes.
Certainly.
Okay. I guess moving on to the next. Thank you. I just saw that pop up in the chat. Moving on to the next is, there was a question that arose from a couple optometrists across the state, and we all are supposed to abide by. I think we established that numerous times with the TAC, talking with DMS, but we're supposed to abide by the fee schedule, correct? And if there's a service that says it's covered on the fee schedule, then is it right if one of the MCOs or their vision providers reimburse that at a $0 amount?
Is there
I
anybody
think we
else?
would need an example.
Um,
I mean, to provide us with examples so that we could look at it. I mean, do you have the specific code or?
I think we probably could find one, but just in general, you know, say it was a 92014, and we bill it and it's on the fee schedule, and they come back and say that their reimbursement is $0 for that code. Or, you know, I don't have the actual codes off the top of my head for that example. I could probably look it up, but that would take a second.
It
But
may
this would
be
apply with,
related, it may be related to your contract with them. I mean, I think it depends on your contract with them, if that particular code would not be payable.
so then what you're saying is, even if it's on the fee schedule as a covered service, if the contract that was signed with the vision provider or the MCO, and whichever in this case, if they had a $0 amount for a code number that was a covered service, then that's a valid contract with them.
Well, you ask a very good question regarding that. Obviously, they are to cover medically necessary services.
Which I
Yeah.
assume are the services on the fee schedule that have been deemed coverable.
Well, they are if they're medically necessary. I mean, I don't know if this particular code that you're talking about, that I don't know if it's if you're just doing it in general question versus a specific code that you have an MCO, I think that would be helpful. But in general, they are to cover medically necessary services on the fee schedule that are on the fee schedule. They can't cover something that is not, unless it's a value add.
Sure.
And
Yeah. And
something-
yeah, well,
something
yeah,
else
I
to think
understand
about,
that.
I think we've had that question a lot. Something else to think about is the MCOs are required to provide those services for for individuals. So if you're at, but it doesn't have to have, every provider doesn't have to provide every service. So a lot of MCOs will have contracts with different providers that may exclude certain things because they for whatever reason, if that makes sense. So each contract can be different as long as they're provided somehow, somewhere, then they're still meeting that requirement. So there's a lot of detail. You'd have to maybe send an example, offline to somebody, one of the MCO specialists that you're concerned about that works with that MCO, and they would have to look at your contract and look at that specific instance and that code to kind of see, whether there's an issue or not.
So Justin, this is Dr. Munson. I'm driving. Am I clear enough for you to understand me?
Yes, ma'am.
Okay, so the question is, if it is a covered service on the Medicaid fee schedule, so the current schedule of medically necessary covered services, is that something that can be reimbursed at a $0 rate? Or is that something that has to be covered and reimbursed at something that is not a $0 rate?
But again, I think it's, the question is a little, it has to be covered by the MCO somehow, somewhere. It doesn't
Okay, yeah,
have to
so
be
it's,
covered by every single provider that they use as a provider for vision.
so that's not what I'm asking, is does it, the $0 rate is what I'm asking. So if it is a covered service, like Matt's example, are they allowed to say a 92014? Yes, we cover it, but the reimbursement is $0. Is that still considered covered when there is a $0 reimbursement?
Generally, no, but again, depends on the contract. So, for instance, if they had a contract with if they contracted with 10 different vision providers and they covered that service through one provider and they paid that service at whatever there was a paid amount for that service, but the other 9 providers, they paid 0 on that service, they would still have that service covered because whenever it was medically necessary, they could send those individuals to that one provider. I'm not saying that's the case. I'm saying that's a one of many possibilities.
And what's the coverage area? Is it as the crow flies?
Well, I mean that again, it's those specifics, right? It's something that you would have to send us a specific instance offline through email, and we would be something the MCO branch would have to look at.
Hi, this is Sarah with the Kentucky Optometric Association. Angie, I sent an email on January 23rd with the information as an example, if you want to take a look at that, and I can resend it if needed.
Okay, thanks, Sarah.
Well, let's move forward from that a little bit then in this train of thought. So say it is a covered service, and say the medically necessary covered service, as we've said, and they are providing it at a $0 or not copay, but $0 reimbursement. And if that is established as not the right thing for them to be doing, how would an optometrist go about reporting this? Who would we report that to?
Angie, there's a complaint line or number?
Yes, Jeremy Armstrong DeRossett is the branch manager of the contract compliance. And there is a link on our website that you can fill out a complaint form, but you can also just email him directly. And Sarah has my contact information too, and I'm always happy to assist when I can. I'm looking at this email right now, and Justin, I'm sending it your way to kind of take a look at this.
So
I'm not a coach, so so we'll need to look at this. We have an example for that.
So then moving a step further, if they are in violation, because it is supposed to be paid at a certain dollar amount, and I understand dollar amounts can be negotiated between providers and the MCOs, but it's some dollar amount, but they're trying to pay it at a 0 amount. If that's found in violation, does that make their contract with the provider invalid then?
That's something that we would have to discuss. If we find that to be the case, that's something we'd have to discuss between the provider and the contract branch.
Okay, then taking that a step further, would that make the MCO's contract with the state invalid because they were trying to provide $0 reimbursements for covered services? You said it would not?
again, I think it's something we'd have to look at on a case by case basis. They're, kind of general questions we'd have to discuss and talk about to see if that's something that has occurred.
Sure.
Then we look, I think what you're asking overall maybe is, and so I can't give you any general statements about anything you've said really. The only general statement I can say is that an MCL is required through their contract with us to be able to cover all the services that are listed on our fee schedule using whatever providers they have in their network. And they cannot reimburse. Something's not covered if it's reimbursed at a zero. That's not considered covered.
Okay.
However, so I can say that. But again, they can use different providers. They can have different plans for different procedures. We can get deep into the weeds there about, how far somebody has to travel to get certain procedures that they may cover with one provider versus another provider.
Well, let me give you this.
They make some prior
Let me give
authorization.
you, right.
So
Let me give you
we have
this.
to look again. We have to look at kind of a case by case, but overall, in general, they have to cover it somehow, some way, at not a zero dollar amount. So again, we'll look at those examples and see.
Sure. So let's think about this, and maybe you can answer this, maybe you can't right off. But so say somebody comes to me and buys glasses, and that's covered under my contract with them for me to provide glasses to them. But they say that they are not going to pay. It's a $0 reimbursement for the dispensing of the glasses to me under my contract. So would they have to provide somewhere somebody can dispense the glasses to them and be reimbursed? And if so, then what's the logic there for them to get glasses from me, but somebody else has to dispense them to them to get reimbursed for it?
I'm not sure. I'll have to kind of look into that. Can't answer right off the top of my head. Think about that.
No, and that's fine. And we can revisit this again later if y'all want to look at the example sent to you. We can come back to it next meeting.
Yeah, we can.
To.
Let us do a little research and let us look at it. I think we have an email that some email examples that we can look at and do some research on.
Sure. I
Yes,
appreciate it.
This is related to the dispensing fee and this one particular provider whose contract allowed that. So I understand that your overall question is, are they allowed to do that via contract, correct?
To provide the $0 reimbursement. Yes.
Right, okay.
Yes.
Thank
We will also, in a follow-up email out to the TAC from this meeting, we will include that complaint email where you can send those complaints to as well, so that you'll have that for your records.
Okay. That'd be great.
Matt, I've been reading the August minutes. We've had discussions about this at least as far back as August.
Yeah.
We ain't got an answer yet.
That's why we're keeping it on the front burner, Steve.
Amen.
Okay. Well, thank you for that. Hopefully we'll have maybe some clarity with it on the next meeting. Appreciate your all's efforts there. The next one, just a question to March Vision. Was there any updates or changes to billing refractions when medically necessary?
I actually looked into that in the past when we spoke about refractions. And DMS does not currently have any limitations on billing for refractions. I'm not sure if that's coming from the MCOs on a limitation, or if you're seeing that through fee for service.
I think the question is more on, we were asking if March would consider covering refraction when medically necessary, because currently they don't pay any refractions.
You're saying that fee for service doesn't, or no one does at all right now?
I'm saying that everybody but March Vision pays for refractions when medically necessary.
March Vision with United. Is anyone from March Vision and or United on the call that can address this, please?
Good afternoon. This is Ann Ritchie with March Vision Care. I believe Dr. Edmonds was planning to be on the call. I'm not certain if he was, but I know he provided some guidance at the last meeting regarding refractions that were medically necessary. And I'm not a clinician, but I believe the discussion was around when those refractions were done outside of the members, kind of routine or annual exam. And Dr. Edmonds, I don't know if you have kind of any detail or we're needing some examples on those.
Yeah, we've taken a look at what the contract is, and I wasn't sure what the update was. So it depends on how the contracts were. Generally speaking, refraction is a time to benefit available only once a year. It has not been paid for on the interim outside of the annual amount. But if it is spelled out in the contract that it's paid as needed when medically indicated, then we would pay it. So we were going to do some contract research to see how that's stated, because it does vary from state to state. Generally speaking, not speaking Kentucky, but speaking nationwide, it is a time benefit. It's only paid as part of that annual exam and not paid. But time, if it's considered a non-covered service, the time spent doing the refraction would count as medical care and could be billed just, most medical care is billed based on time. You would move it to a different level if indeed you spent that time doing medical care that wasn't covered. If it's covered, just like fields and OCTs, the time when you bill those codes, you can't bill that time you spend on interpreting or doing an OCT or a field, because that's paid separately. But if it's not paid separately, then you can bill that time. So that's my understanding. But if they have specific language in Kentucky that says it's paid as needed, then we would pay it as needed. So I haven't gotten an answer back from legal on how that's worded for the state of Kentucky. So I just want to be compliant with whatever their regs are based on the wording of the benefit.
Right. It's Ann again. Scott, thanks for the update. I can work with you then to make sure we get some feedback and an update from legal, so we can close that issue. So thanks for the reminder on that.
Any questions from any of the TAC members on that? Hearing none, then thank you for the update. We'll be interested to hear what your final verdict is on that, hopefully before the next TAC meeting. Okay, so the next, I guess, looks like, if I'm not mistaken, deals with most of the stuff we talked about in the special call meeting. And I'll turn this over to DMS if they just want to go down each one of these follow-up questions and give us any kind of answers they can there, if that's okay with you all.
This is Kelly Kitchen. So for the first question, has CMS approved the new enhanced benefits? That has not been approved by CMS yet. So we're still pending a response. And as far as how optometrists are supposed to be handling the billing of adult glasses, children, adult contacts with the new enhanced benefits right now, currently, everything is paying based on the 2022 fee schedule until we get the approval from CMS. Anything that is approved for 2023 will be backdated, and there will be mass adjustments to claims if they've been billed with any codes that are on the new fee schedule and approved by CMS. Will the MCOs be giving optometrists and providers 30-day notice on the changes? I believe that's contractual.
And so if they're supposed to give a 30-day notice, then we should expect that as soon as CMS approves and you all pass that along to us, right?
Correct.
Okay.
I have a
Any
question, man.
discussion? Yes, I was getting ready to ask any discussion here.
So this is DMS's suggestions that CMS has not approved this. We have patients coming into our office wanting these benefits now. If we go ahead and provide these benefits and for some reason CMS does not approve them, so are we just going to lose what we've invested?
I mean, I don't know. This is Justin Derringer. We've had this happen several times. At least even since I've been here, I haven't been here that long. But we've never had an issue where CMS didn't approve or didn't at least approve us to make payment. So I think we'd have to kind of, and I understand what you're asking, but I don't think that's ever happened that I know of. I don't think it's ever happened when we look back and say in the history of what people have been here have known. So I don't think that's something that we've ever encountered. So I don't know if I can answer your question fully since none of us have ever experienced that. As you all know or may not know, in the administrative regulation world, this happens a lot where an administrative or something has changed in policy. We have to operate out of a certain way based on time frames and system. And then, but it takes an administrative regulation a year to change. And so legally, it might not be fully, in operation for 12 months, but we may have to start something within 6 months. So that's just kind of how this process has went. Sometimes, like regulations, CMS is a little slow. That's, I guess, my response to that question.
Well, having said that, Justin, so if we go ahead and start providing these services right away, is Kentucky DMS going to start paying for those services right away, or are we going to wait to see if CMS approves them before they pay them?
Those services would be reimbursed as soon as CMS approves. They wouldn't be paid now. They would be reimbursed when CMS gives approval.
And you said that could take 6 months, could take a year?
No. I was using as an example of the administrative regulation process. We don't anticipate, I don't have an approximate date. I wouldn't anticipate it to be very much longer at all. But I can't tell you that 6 months to a year was just talking about how sometimes we have to implement policy before regulations finalized. In a similar way, sometimes we have to implement fee schedules before CMS gives final approval. It was just an example comparison, but I don't anticipate it to be, anywhere near that kind of time frame.
So do you all have, though, any mechanism in place to reimburse doctors that have gone ahead and started doing this if CMS says no to all or any of the benefits that you all proposed?
Again, that's something that's never happened. So that would be a bridge that we would have to cross and figure out, DMS has never, that I can remember, and maybe you all have some examples where we've left providers hanging financially. So I don't think it would, but I can't give you any kind of definite answers. It's never happened.
Well,
it's just kind of how things are done. I don't know with fee schedules.
Sure.
We don't ask that question a lot, but
I can speak. say I can speak for myself. I don't know about any of the other providers across the state, but I don't get the warm and fuzzies to provide services knowing that they may or may not be reimbursed to me.
Yeah, I understand that. I get it.
Dr. Burchett, this is Erin with DMS, and sorry to cut you off, Justin. So Kelly Sheets and I are also the spa coordinators, so just a little bit of feedback. CMS is working with us to try to make sure all the language is as it should be, so that everything that we want to cover is covered under what federal regulation and law allows. And so that's just been, there's been a lot of questions back and forth, and that's the only reason I believe, since I've been doing this, that they haven't been able to move forward. Just to make sure that they're understanding what we're trying to do. And my learning training history, a spa has never been rejected. They try very, very hard to work with us. Now, as far as the billing aspect goes, that's a little out of my wheelhouse. But that's just a little bit of background about the spa process. So there's just been a lot of questions going back and forth because we have not altered these services in many years. So they're just trying to make sure that they are understanding what we want to do, how we want to do it. And we just recently got some more questions that we've turned around and answered. So we are working very diligently with CMS to get this approved as quickly as possible.
Sure.
We're the government. Just trust us.
That's what we're afraid of.
That don't make me feel good. Sorry. Anyway, going back to the first bullet point there, do you all have any response to the letter that the TAC sent you with recommendations from our meeting we had in December? And if so, were there any changes that you all decided to make from those recommendations?
So at this time, we are going to keep the fee schedule as we have it until we get through the approval process with CMS, get the regulations updated, and get the system changes put in. Once that has happened, then we may come back and revisit those requests for changes. But until the actual CMS approval happens and policy or the regulation gets updated, we're going to keep everything as is, and then we will come back and re-review to make any additions that's been requested.
Okay.
And this is Justin again. We do have that, those recommendations. Some of those are very good. And, you know, when we talked to all the different provider types that had this expanded coverage, this is the first time we've ever done anything like this. And, you know, we've changed those fee schedules, I don't know how many times, up until about the time that it was CMS. And that's another reason why it's taken so long. We made a lot of adjustments to the fee schedule based on stakeholder feedback there at the very end, because we realized we missed some stakeholder groups, and there were some other groups we wanted feedback from. And so we made a lot of changes deep into, you know, when we should have already had these things posted. So a lot of that's on us for not including, you know, all the stakeholders that needed to be included, and having such a time crunch. But we are, as always, we have those suggestions, and, you know, being a new expansion like that, there are going to be a lot of changes to that fee schedule. Not changes, but improvements. And not from us, from you all, from stakeholder input and feedback. And so we'll make those throughout the year. And whether we do a special June or July change to the fee schedule, or whether we wait till January 1st of the 2024 fee schedule, we're definitely going to make some changes, and a lot of that's going to come from the input that you all have provided. So I do thank you very much for that. And we do have it. But at some point we had to stop and with CMS and say, this is it. This is where we're at for now, in order to get this thing moving.
Okay. Thanks for that input. Any other discussion on any of that from the other TAC members?
I guess my question, Matt, too, would be for the MCOs. Is it going to be the same situation where are they going to start paying for these new enhancements right now, or is that also going to be held back until all this is approved and then the 30-day notification? So where are we sort of at with the MCOs?
Hi, this is Jeremy Randall with Anthem. I want to assure you that we are paying for these currently and ready to receive these claims and process them.
Hello, Dr. Upchurch. This is Nicole with Avisus. The Avisus administered plans are also configured and are paying at the DMS released fee schedule.
I appreciate that, Nicole. I knew that yours was. I didn't know about any of the others. Jeremy, I appreciate that input on yours. What about the March and
Yeah, good afternoon. This is Ann again at March Vision Care. We're in the process of finishing up our configuration, so we should be set to pay those, I would say, by early next week.
And will you all have grids for different the different MCOs as to what their reimbursements and things are that'll either come out to us or be on your website?
For March Vision Care, I believe it will, the reimbursement to the providers will be based upon the contract that those providers have with March and the Medicaid fee schedule that was published. So I don't know that there's going to be anything additional that'll be published on our website, but I'll certainly be happy to confirm that.
Okay.
Any other questions on that? Clarifications? Okay, thank you to the department for thanks for that clarification from DMS. We're going to move on to the new business portion. And I think this is something Steve brought to our attention. So I'm going to turn it over to Steve to discuss this one.
Yes, we have an issue or had an issue. I thought I had it. Here it is in my hand. Cindy's in here, but she said, please don't make me talk. No, the printout from the, okay. Anyway, we had a recoupment on a patient that we went back and looked, and on the DMS website, it said the patient's eligible on the date of service, and on the Vision subcontractor website, it said they're eligible. And we saw the patient and we got paid, and then some point later, I don't even remember who they recouped the money. So, then what do? You've looked everywhere you can look. It says they're eligible, and then you provide the service, and then they take the money back.
Can you send me an email with all that information? We've had a couple of cases like that. We're trying to track down exactly why.
Okay, I've sent it.
So if you could send me
Sarah,
that.
I think you've got it, right, Sarah Unger?
Hi, this is Dinah. Sarah's audio is not working, but we're in the same office, and she told me to tell you, yes, she's got it, and she will send that on.
Okay.
Okay.
Thank you.
We'll and again, we're aware that it's not happening a lot, but it is happening, and we're going to get that taken care of. I think we've got it kind of narrowed down, but any extra cases I can get to look at helps us to make sure that it's only happening in certain instances, but we are aware of that, and we'll take care of that.
Okay, and they'll forward that to you. It was Humana Visas. Just, I guess, an FYI thing. All right, thank you.
Any other questions or discussion there? I think it sounds like we've got that one figure it out a little bit. We'll get that information in there, Steve, and see what we come up with. Going back, I've got just to the previous number 4 we were talking with the department on some of the stuff that was sent to CMS. I just had a follow up. I've been trying to run it around in my head here for just a second, but so say if CMS improves the enhancements to the plans for the patients, and the department, like you said, currently you don't think you'll change anything on the fee schedule. You said you thought that would stay the same for now. As a provider, what happens between myself and the patients if I don't feel comfortable giving them one soft contact lens for yearly wear? Then am I in violation of my agreement, my contract with any of the MCOs that are providing that, or with the department for fee for service if I don't decide to do that yearly contact?
You're not, and actually, I think we spoke on this before, was the items that are on the fee schedule are items that DMS will pay for if you provide that service to a member. That they are not services that DMS says you have to provide these services to that member. It is an option based on medical necessity and what the provider feels that particular patient may need, may or may not work for them, or that patient may need.
Okay. So then if we don't feel comfortable doing that, then it's a service that we can just say we don't provide, basically.
Yes, that is correct.
Okay. What about the MCOs? Would that be the same through the MCOs?
Hello, Dr. Brichette. This is Nicole with Avisis. Yes, that is true.
This is Jeremy with Anthem. Yes.
Kimberly with Passport. Yes.
Okay. Well, I guess that answers that for us. And I appreciate the clarification again. I thought we talked about that stuff, but I just wanted to make sure that I understood it the right way. Thank you all. Moving on, next is a general discussion topic. And I've got something to throw out to the TAC on this, and some of it stems from, I think, what Steve had talked about, that the MAC had talked about maybe a little bit from time to time. But would there be any, and this is a question really for the department to start with, is there any possibilities for us to increase reimbursement for codes that we provide service for, that would improve the quality of the outcomes for the patients? Maybe not all fees, because I know some fees won't make a lot of difference in the quality of outcomes that happen in the exam that we give. But there are some testings that we can do and things like that, that if we have that information, then maybe we can provide a better outcome for that particular patient. Would there be any thought about looking at a fee increase for some things like that we might be able to provide you a list of those codes?
Yeah, absolutely. This is Justin again. We're always open for providers to send us code or codes that they feel like are underpaid or are not utilized because payment's too low. And what we do with those codes is we'll research those. We'll look at the Medicare rate if there is one. If there's not one, we will look at other states and see what they're paying all the surrounding states. And then we will come up with a report, an analysis report comparing and contrasting. And then we'll go look at our budget and see what we got, there. So it's a multi-stage process, but we're constantly doing that with all provider types with a variety of codes. So we always encourage providers, if you see some codes that you feel like are not paid enough or to be used, or those codes aren't used because the payment's too low, then send us those and we'll research those and we always get back to you and let you know if there's something we can do or not, or if the research shows that those need to be upgraded or not. And we're always doing that. So absolutely send us those codes.
Dr. Burchett, are you talking maybe about value-based contracting as it relates to quality as well?
Possibly. I haven't really dug really deep into it. Just thinking about some of the things we do in office that if we would reimburse more, we could start to utilize better, like he was saying, underutilized codes because the reimbursement is so low.
Okay.
That we could improve outcomes for some of the population. But no, we're open to looking at anything just about.
Well, I mean, the value-based contracting would be through the MCO's subcontractor or contractor or whoever provides the optometric provider network and who you contract with those. That could be something you could have a discussion with them about contracting for value-based programs.
Sure. Thank you. So then if the department is up for that, I'd say the TAC will put together a list of those codes and send over to you, much like we did with the information on the fee schedule stuff from the last meeting. If that's okay.
Yes, sir. Thank you.
Brad, I have a question. This is Steve Compton.
Yes.
And it's for my clarification. At the MAC meeting, I think it was stated that the MCOs by contract have to spend 90% of their income on patient care. And I'm paraphrasing here. And the other 10% is on administrative cost for them to administer their program. My question is, are all these value-added services like laptops and phones and electric toothbrushes or what have you, is that part of that 90%? Is that considered the 90% that they have to spend? Or is that coming out of the 10%, the administrative portion? And I may have misunderstood what was said at the MAC meeting as well.
Angie, do you know the answer to that?
Well, this is
Well,
Stuart.
I started talking before.
Sorry.
But go ahead, Stuart. You can probably answer a lot clearer than me. But.
Well, I was going to say, this is Stuart Owen. I'm 99% certain that it comes out of the 10%, not the 90% of the healthcare. It's extra from the MCO, that 10%, not from what's paid for member benefits, the 90%.
Thank you.
Yeah, because the 90% and the 10%, it's a medical loss ratio that they have to meet, and where that administrative versus healthcare dollars. So I'm with Stuart as the 99% as it falls in the administrative as well.
All right, thank you.
But if it's not, I will definitely let Aaron or Kelly know and they can pass that along.
Okay, thank you.
Thank you for that clarification, everyone. Steve, that's a good question. I didn't know the answer to it either. So any more from any of the other TAC members on the general discussion? Any other general things we want to talk about or have on your minds?
No, but what Justin said is encouraging to me that they'll at least look at it. Consider.
Yes.
Yeah, that's a whole lot better than no.
Right. Well, hearing no others there, we'll move on to number 7. And I would like to go ahead and make a motion that the TAC send the recommendations that we sent to the department on 12/28/22 to the MAC as a recommendation from the TAC.
I concur with that, Matt, if you need a second.
That's what we're looking for. Any other discussion on that from the TAC members? Hearing none, then I will take a vote on the motion for us to send those recommendations to the MAC from the TAC. All in favor?
Aye.
Aye.
Aye. Any opposed? Hearing none, then we will put that together as in the form of a recommendation to send on to the MAC for their next meeting. I think that's in March, Dr. Compton.
Yes, it'll be a bit before we meet again, but I'll have it.
Yeah.
Ready. All right.
So that way, maybe you can talk a little bit on it there as well. So,
That's part of the public record too, so.
right. Appreciate it. Are any other business to discuss from the TAC? We've got our next meeting dates there. I think it's May 4th, looks like. So hopefully we'll hear back on some of these questions that we have talked about today to get some clarity and maybe put the issues to bed once and for all. And that'll be good. Past that, I would entertain a meeting to adjourn.
Motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Aye. Thank you. Thank you, everyone.
Thank you. Take care.
Thank you.